Welcome to September School Updates. I want to thank everyone for coming tonight. We are so grateful to have you here and especially share information regarding the wonderful opening of schools this year. I would like to introduce the following people who have made tonight possible. Thank you, Megan Davey, our Advocacy Systems Specialist for Children, Family, and Advocacy, Alpha Resource Center. My name is Jennifer Connolly. I'm from Santa Barbara County SELPA. I would like to thank Georgine Lowe from Santa Barbara County Public Health. And I would also like to thank our wonderful school administrators that are here today on this Zoom. I want to thank Gina Stabile, who is here doing our technical work behind the scenes, and our wonderful Yesenia, who are both from Alpha Resource Center, who are sharing this wonderful Zoom with us tonight. Tonight, we have a wonderful agenda planned. We will hear a presentation by Santa Barbara County Public Health. We have several members here from Santa Barbara County Health Department. Georgine Lowe will be presenting in their behalf tonight. Secondly, we will have two breakout rooms, one in North County and one for South County. We have some fabulous administrators that will join the North County breakout or the South County breakout, depending on where the districts are located. And then you will be asked to join your prospective district. So our North County partners will be Santa Maria Bonita, Santa Maria Joint, Orcutt, Guadalupe, Lompoc, and the San Ynez Valley. Our South County presenters will be Goleta, Santa Barbara, Carpinteria. So if you are from the North County districts, you will join that breakout. And if you are in the South County districts, you will join the South County breakout. And we will give further details on joining those breakouts in a few moments. During this time, your administrators from those districts will share a little bit about the opening of their school year, and they will field general questions regarding COVID-19 and the opening of schools. Finally, we will come back together and my wonderful Megan and I will share some last comments from the discussions in the breakouts. So some Zoom grounding. For tonight, we ask that you remain mute throughout the training unless we call on you and ask you to clarify. Our wonderful Gina will unmute you if you need to speak. She is asking as well if you could put your name and where you are from, if you are North County or South County, in the chat. That would be really helpful as she is creating our breakout rooms at this time. Secondly, please use the chat for questions. Megan and I will be monitoring those questions and sharing them out loud to our presenter and then again in our breakout rooms. Please share questions that will benefit all. We will discourage questions that are related to specific student issues or student comments at this time, to keep confidential, of course. And then finally, we are just delighted to share this platform with you, this information that is so needed at this time. We want to keep this a positive, pleasant experience for all. So please share the happiness and the wonderful sentiments that have occurred in starting back to school and trying to get back to the new normal. So without further ado, I would like to welcome Georgine Lowe from County Public Health to give us a back to school safely update. Georgine.
Thank you, Jennifer. Thank you everyone for joining us this evening. As she mentioned, my name is Georgine Lowe and I'm part of a team of folks from both the Public Health Department and Santa Barbara County Education Office.
Georgine, you are muted.
Okay.
There we go.
There, I was muted. All right. Thank you again for inviting me here this evening, and thank you all the participants that have come out to hear this presentation. My name is Georgine Lowe, as Jennifer mentioned, and I am representing a team of folks from Santa County Public Health Department, as well as Santa Barbara County Education Office that have come together as the Safe Schools for All team. So communicating when the next slide is to move. There we go. Thank you. This is a list of some of our school team members, the Safe Schools for All team. Many of them, I think all of them, are on this at this meeting tonight. So that's wonderful for both moral support and to help answer some questions that we might have. We also, our goal is to facilitate the communication and collaboration with school administrators and parents, staff to support in-school learning, in-person instruction. Very important that we're moving in that direction. The California Safe School for All program was developed in partnership with the California Department of Public Health. This just shows the web page. That is a huge resource for our work that we're doing as the local health jurisdiction or public health department. It's also available for school administrators asking questions, getting updates, as well as parents. So for yourselves as parents, there's a lot of really good information here. And it's all updated on a regular basis. So I recommend checking that out. So our agenda for tonight is I'm going to provide a summary of the science as it relates to the COVID pandemic. We're going to check in and kind of do a quick overview on the status of what's happening locally and where schools are at in this endeavor. And then we're going to leave time for questions and answers. And I think most of them will be should be placed in the chat. So starting with summary of the science, it's important to protect Californians. Oops, go back one, but yeah, summary. To protect Californians, we need to control the spread of COVID-19 in our homes, workplaces, and communities. Reviewing the science is very important for us to understand the efforts that we can move forward safely in opening schools. COVID is currently widespread in Santa Barbara County. Most of you have heard that. We know when it's prevalent in the community that students will bring it to both schools and childcare programs. Okay, in terms of the basics, how COVID is spread, you've heard a lot about this, and I think initially we used to think that it was spread on surfaces and people could pick it up from tables and other surfaces. Thus the shortage of disinfectants, paper towels, and for some reason toilet paper. But now we know that the virus is primarily spread through close contacts. Close contacts are defined as in-person contacts within 6 feet of an infected person for a period of 15 minutes over a 24-hour period. And that's because you can breathe it in the air when you're close to an infected person. You can also have the small droplets from an infected person get in your eyes, nose, or mouth. And that's why it's important also to do a lot of hand washing, because you can also touch your eyes, nose, or mouth with hands that have virus on them. A person is considered infectious. One of the difficulties is they're infectious before they're symptomatic, so before they get sick, and up to 2 days before the illness onset. And also 2 days before you actually have a positive test. So that's what's tricky here in terms of the spread of the virus. And also now we know that droplets may remain in the air for periods of time. And that's why we're really promoting ventilation in schools and cleaning and mandated mask wearing. In-person school has been demonstrated to be a lower risk activity than some of the other gatherings that we have in the community because of all the mitigation of all the efforts schools have done to make themselves safe. So really, they're rolling out a lot of different safety measures, both in childcare programs and schools. And so we want all children to return to school safely. We call this the Swiss cheese approach to making schools safe. So we're hoping, now that vaccinations are available to 12 and older, that students get vaccinated as well as staff, that sick children stay at home and receive testing for COVID, and that outdoors, people remain outdoors when possible, students outdoors, and improved air quality, whether it be opening doors and windows or actually having ventilation systems that help move clean air through. And of course, wearing masks indoors and cleaning your hands. The multi-layer approach has really impacted our school's ability to stay open, to open in the first place, and then to remain open. So let's talk about the COVID virus, the Delta variant. So what has changed with the Delta variant is that it's 2 times more infectious, more transmittable than the previous virus strains of the Delta virus, of the COVID virus. It's 1,000 times more viral load, so more particles in the droplets that contain the virus. So it's more infectious, and it has a shorter incubation period. So up to 2 days, people can incubate and transmit the virus. This all comes down to why we see such a wide spread of this COVID variant. So our current outlook, this slide represents what we were seeing in the past in California with what we called the winter surge, so almost a year ago now. And then we saw signs of it growing recently. Due to the Delta variant. The other graph shows hospitalizations for children, daily admissions in both California, Florida, and Texas, and in the US. And you can see from this graph that the red line, which is Florida, is much higher than any of the other lines, and also Texas is much higher. And in California, you can see the rates of hospitalizations for children is much lower, and we believe that's due to all of the mitigation efforts that are happening in the community: vaccination, mask wearing, all of those efforts. Right now, the Delta variant is overwhelmingly circulating, and as of August 21st, 98.3% of the samples were due to the Delta variant. The good news, I was on a call this last week with the State Department of Public Health and their Safe Schools program, and they reported that there's signs right now that are showing that school age rates are marching down, they're the words that they used, and that pediatric hospitalizations have plateaued. So it looks like things are getting better, where we hope. Also, California has not exceeded the hospital capacity like the other states, as I mentioned, and it's likely due to the mitigation efforts and the community support behind getting vaccinated and mask wearing. Next slide. So this is Santa Barbara County's Delta variant case numbers. So it started at about 1% of the cases we were seeing in May, and now it's all the way up to 98% last month. So you can see how it's really changed the landscape. I think right now, as of August 29th, case rates were 19.6% per 1,000 and a positivity rate of 6%. So all that means is that it was up real high. Right now, we're seeing outbreaks in schools I think today we reported 25 schools now are considered having outbreaks, which is 3 or more cases that are not household linked. And Santa Barbara County is experiencing more positive cases among younger people. Even though children are 0 to 17 make up about 23% of the county's population, they're about 10% of the county cases right now. And 3% of our cases in the hospital are 0 to 17, which is not too bad. And the good news there is that hospitalization rates have come down from 80 in the last week to now currently about 70. So we're happy to see that move. Percentage of population fully vaccinated. So these show the US population, California, and then Santa Barbara County. These numbers, California was August 27th, and the US and Santa Barbara County numbers came from September 4th. So currently, we're looking at, if you start looking at total populations, there's 453,498 people in Santa Barbara County. 12 and up, those that are eligible to be vaccinated, is 368 or 63 or 383, sorry. And of those that are eligible, those 383,000, currently there's 65.9% of them are fully vaccinated, which is a much better number than you see on these graphs when you look at who's eligible as opposed to just how many percentage of the population. And 79.6 of them have had their first dose. If we look at children, when we're talking about schools, so 12 to 15, it's 45% right now are fully vaccinated. School-age children that are eligible, 16 to 29, that's just how it's broken out, is about 61%. And then the older age groups, the older the age group, the higher the percentage. So 30 to 49-year-olds, it's now 58%. 65 to 74 jumps up to 76%, and 75 and above, it's 79%. So we're doing a pretty good job in Santa Barbara County of getting people vaccinated. And why do we want to see that? This just shows the daily case rate of unvaccinated versus vaccinated people in Santa Barbara County. So you can see that 32% of those people that tested positive were unvaccinated. It's actually, if you look at the individuals, it's 4 to 5 times higher, more likely to be infected than vaccinated individuals. So we know that people that are vaccinated can still get the virus and test positive for it, but the vaccination is working because those people are not as sick and they're not being hospitalized at the rate as the unvaccinated people. And that's exactly what we expected the vaccination to do, was to impact our ability to fight this virus and not become severely ill from it. However, we can still transmit it, and they're looking at the transmission rate when you're vaccinated might be a little lower, meaning that load I talked about, the viral load, would be a little less. So it's not as transmissible, but we do recommend even vaccinated people wearing masks. Of course, you know that. Okay, so let's talk about schools. So so far, how's this impacting our schools? Schools and childcare providers are doing a tremendous job of contact tracing, communicating with families, and taking steps to make sure schools and childcare places are safe for children. Our research shows that validates that we must keep schools open to promote mental, social, emotional, and academic well-being of students. It's not an easy task. Many of you know this, but along with the American Academy of Pediatrics that strongly advocates for policies consideration for school plans to start with the goal of keeping students safe and physically present in school. And it's also well documented that in-person learning, there's already that it's much better than virtual learning. There's already evidence of the negative impacts on children because of school closures last year. So Santa Barbara County School Districts, we have 20 school districts, and I think I got this right. I think there were 75 schools, and we're just talking about the public schools. And of those, we have 70,000 teachers working in those programs. There's also the charter schools and private schools. There are the childcare programs. And so when I talk about 25 schools that have outbreaks right now, that's not too bad. We're doing pretty well. And of those outbreaks, the numbers are not that high. So they're small, anything, like I mentioned, 3 and above, cases 3 and above, and that includes staff as well as students, is considered an outbreak and is being followed by the public health department. So let's see, okay. School associated versus in-school transmission. So these are some of the things that, which we talked about, the multi-layer approach that schools are involved in to minimize in-school transmission. So how schools are helping, they're educating families about vaccines. They can host school-based vaccine clinics. Public health is rolling out some clinics as we speak. I think there was one this week, and there are plans for more to be held on school sites. So we're doing vaccine clinics. It's something we've done in the past, but we're continuing to do that to make them eligible for the school staff, the students that are eligible 12 and up, and also the community members, so parents, anybody else that's interested. Also educating families about the symptoms that we're looking for, and children staying at home when they're symptomatic, and conduct screening testing. Some are conducting surveillance testing now, and some are testing students that have been in close contact. Certainly identifying and isolating positive cases and anybody that's symptomatic, and identify and test exposed students, which I'm going to talk a little bit more about. Enforcing universal masking, maximize vaccinations in their programs, so they're monitoring that. And also there's now some mandates that have come down about vaccinated staff in programs. And good ventilation, good hygiene, and conduct response testing and contact tracing. That all sounds like a good list, but it all together is a big undertaking for some of our schools that have minimum staff to be able to take on all these tasks. So this is also part of that parent page on the Safe Schools for All website. And there's a lot of updated information. If you have questions, you can go to talking about testing, talking about just the science behind how schools are opening, and any new school guidance, which keeps coming out all the time. So updates on how to communicate some of that guidance and clarify some of the things. Symptoms of COVID in children, similar to adults, but seem to be a little milder. We've seen a lot of runny nose and congestion, and really educating families and schools around that may not just be a cold, and we want to investigate and have those children tested. Sore throats, tiredness, diarrhea, all of that. Clearly, children can be infected and transmit it. So bringing infectious children into your home, you definitely want to try to isolate as much as possible, keep them away from grandma and grandpa, because, continue the mask wearing at home when possible. Typical, okay. Oh, so there's, when students are identified, there is a requirement that they're sent home to isolate if they're symptomatic, and they require documentation from their healthcare provider if they're not tested, to see if there's other underlying conditions that may be causing the symptoms, and also confirm an alternative diagnosis like a strep throat or something like that. And I'll talk a little bit more about that. So vaccinations, strongly recommended. I mentioned the mandatory vaccination in schools and staff. And if you're not vaccinated as a staff member, there's a requirement that you're tested weekly. And I believe that's a PCR test that will be implemented or in place mandatory by October 15th. A lot of schools have already implemented it. We know that vaccines are not yet available for children 11 years and younger. So we want to make sure that anybody that's eligible is vaccinated, that's in contact with that population. Did hear news that maybe that will be happening sometime soon within the next couple months. FDA approval for children 5 to 11. What else? Okay. Universal masking for safety. So a lot of agencies are requiring masks now, and I just saw something come across my phone about now the U.S. government is requiring that vaccination. Sorry, but universal masking is happening indoors, and a lot of programs are starting to look at outdoor masking too, where social distancing is not taking place. We're, because of the science around masking, that's why these mandates are coming down. Locally, Santa Barbara County Public Health Department has issued a health officer order. It was back in, I think, August 6th, that requires all individuals, regardless of vaccination status, to wear face coverings when indoors in public settings, and there's very limited exceptions. And universal masking allows for modified quarantine, which I'm going to talk a little bit about in a minute. And if everybody does it, then it reduces any stigma and bullying. There are exemptions that students can get. Any person younger than 2 years old is exempted. Persons with a medical condition, mental health condition, or disability that prevents wearing a mask is exempted. Persons who are hearing impaired or communicating with a person who is hearing impaired, where their ability to see the mouth is essential for communication. Persons whom wearing a mask could create a risk to the person related to their work. Any assessment for exemption due to a medical condition needs to be confirmed with a licensed healthcare provider, such as a physician, nurse practitioner, or other licensed medical professional. Schools should offer alternative educational opportunities for students excluded for not wearing face coverings, and persons exempted due to medical conditions could also wear a non-restrictive alternative, like a face shield with a drape or physical distancing for limited reasons. So why masks? This little graph here demonstrates how a mask works. So the first picture shows the person without a mask, and the droplets, both large and small, infected droplets transmitted to the people that aren't wearing masks. When both people are wearing masks, obviously the transmission decreases. So testing options for the school community. This does get a little complicated. Keeping track of COVID cases and some surveillance testing that is happening in our community, and also to prevent outbreaks of new cases via screening, and then responding to school outbreaks. So when people are tested after a exposure to an infected person, that can be done at the schools. Santa Barbara Unified, I believe next week, is starting some testing of all of their elementary school students, and they chose to do that because those are unvaccinated students, so they want to kind of monitor outbreak in that in the elementary schools. So had a school nurses meeting yesterday where we were talking about how they're just going to start rolling it out and see how it goes. It's a big undertaking, but I certainly applaud their effort. Anyone with symptoms should obviously get tested and should isolate as soon as possible and removed from either at home or in the home too. They need to isolate from the other family members. And then vaccinated individuals who are not required to quarantine under current CDC guidelines, but they should also be tested, even if they're vaccinated. Okay, let me talk a little bit more. Other public health interventions to keep students safe. Hand washing, these are all probably well known. Washing your hands regularly reduces the amount of germs on your hands to prevent the spread of COVID-19 from touching surfaces. Mentioned this before, but good ventilation in classrooms helps those droplets move out of the classroom instead of lingering. And also contact tracing. Your child's school or local health department will notify parents and teachers who have close contact with someone that has tested positive. If they've been, again, in contact with this person for within 6 feet of this person for over 15 minutes cumulative in a 24-hour period. Also staying at home when you're sick, just to reduce the spread of the disease. If your child feels sick, keep them at home. And they will probably get better faster, but also check in with your school to let your school know that they're staying at home. And if they're symptomatic, please seek testing and let your school know about that as well. The results. Okay, so this is a infographic sort of algorithm. It's hard to read on this slide, but it's readily available on the Public Health's website on the COVID portal that you can link to information for schools and this schools and childcare. And this is on that website. We can probably put it in the chat or something too. So what happens when the students have close contact with a positive case in the school setting? So this algorithm shows on the left, if they're positive and they're symptomatic, then they need to isolate. And then if they have a negative PCR test, which is not the rapid test, but the longer test, then students may return to school if they've been asymptomatic, have no symptoms for 24 hours. That includes a fever without any kind of fever medicine. I think just in the interest of time, if you look to the right on the positive close contact that are asymptomatic, this is where what we call the 3 types of quarantine, and you'll hear that from schools. So there's the traditional quarantine or 10 days of quarantine if somebody's not symptomatic. So that's kind of that first close contact asymptomatic. It's recommended that they are out for 10 days and they're observed for symptoms for up to 14 days. So then if if you go to the right of that, if they're unvaccinated, oh, just to mention too, if they're vaccinated, there's no need to quarantine. They can remain in school if they're asymptomatic. So the key is that they don't have any kind of symptom. It's also recommended that the vaccinated people do get tested too. If they're unvaccinated, and you'll see those little arrows, and they're both masks, that's what they call modified, what we're calling modified quarantine. And so if you read the fine print in there, it means that the child can stay in school and he can attend class, but no extracurricular activities, including sports. So they're just there. The purpose of this modified quarantine is to help children remain in school. So there's, oh, thank you. I just saw that pop up in the, so there's what they need to do is test as soon as possible, and then also test within 6 to 7 days from their last exposure. And then they can return to normal activity, meaning they're already in school, but they can enjoy their extracurricular activities on day 8. The other one, if either one of them were not masked in school, then they have to quarantine at home, and the quarantine can end in 10 days, or this is called the shortened quarantine. If they're symptomatic, if they're not symptomatic, and they receive a negative test on day 6 or 7, again, testing early, hopefully within those first few days that they've been sent home to get a COVID test. And then on day 6 or 7, if it's negative, they can return to school on day 8. It's a lot of information on there, but it's really good information. So it also is available in Spanish that you just saw. And then this slide that's the Spanish response. And this slide speaks to when they're testing at schools and or at your healthcare provider. Asymptomatic students, so students that don't have any symptom, but they were a close contact of somebody, they get an antigen test and it's negative, that's the rapid test, then they don't have to do anything. They're fine, they're asymptomatic. If they have a positive antigen test, then they need to isolate and go into an isolation at home. Where it gets a little tricky is symptomatic individuals. If they have an antigen test, a rapid test that's negative, they have to follow it up with a PCR test. If it's positive, then they would isolate, and if it's negative, then no need to quarantine. Or if it's close contact, then they do need to quarantine. I think that's, I'm sure. Okay, when we talk about quarantine and counting and the modified and the 3 different types, this infographic helps to explain when students can return to school. So there's a lot of information here too, but if you walk through it, when you look at it, the last day of contact with the person is actually, so the infected person was at school on Monday, and that counts as day 0. So you count 10 days after that, and they return to normal activities on day 11. If you're using a modified quarantine and they're still in school, then you still want to look at the optional testing on the day 6 or 7 and return to school on day 8. And you also use the same principle for the shortened quarantine or testing out quarantine. Okay, so that's quarantine. And then for isolation, same thing. When your symptoms start or you tested positive, that's day 0, and you count out to day 10, and you can return that for isolation and return on day 11 if you're not symptomatic, meaning you don't have any symptoms, and that includes not taking any medication for fevers, you can be released from school. I mean, return to school, sorry. Okay, so students with disabilities or other healthcare needs, I'm sure all of you are very aware of this. But districts will work with families to better understand the individual needs of students with disabilities, customize and individualize approaches as needed, ensure access to learning and services for these students, provide access to direct service providers, like your therapists, early intervention specialists, mental health consultants, provide additional PPE for teachers and staff, giving social distancing limitations, the face shields and masks that I talked about, and drapes, and wearing masks may be difficult for students with certain disabilities, thus the exemptions. So offering alternative educational opportunities for students and that have been excluded for not wearing face coverings. That's also what school districts can do for you. Okay, so it takes a village. COVID-19 is not just a school issue, it's also a community issue, and we must all do our part to keep each other safe. To protect all Californians, we need to control the spread of COVID in our homes, workplace, and communities in order to detect infections early and limit transmission of the disease. Public health officials across the state have undertaken a multi-pronged approach, which includes encouraging vaccination, offering testing, promoting public health practices like mask wearing, and continuing robust case investigation and contact tracing with effective isolation and quarantine of those infected or exposed to COVID-19. And with that, I think I'm done. Questions, which I saw some pop up in the chat. I think I'd turn it over to somebody. Yes.
Yeah, Georgine, I organized all them for you. So one of the questions was, is there a special test that shows the Delta variant? And how do you know if someone has the Delta variant versus another strand of COVID?
There is a way to look at variants, and that's what the public health does when they're looking at looking at what type of variant it is. It's called something. There's a couple people on here that might be able, if you unmute them, they might be able to ask or answer that question better than I. But yes, there is a way to do it. If Matt Higgs is on here, he raised his hand. If you could let him speak. Somebody.
Thank you, Megan. Quick introduction, I'm Matt Higgs with the Public Health Department. I'm the ELC program manager, working with all of our COVID response teams, including our Safe Schools for All folks. So there is not a rapid test or any specific community available tests for distinguishing the variants. To distinguish the variant, the specimen needs to be sent out for whole genome sequencing, which requires a special lab. Currently, the state has increased the capacity for that surveillance, so a lot more samples of COVID are being sent out to get whole genome sequencing. But as an individual, you probably will not be told if you had the Delta variant or another variant. Right now, Delta is the predominant variant in the United States as a whole, in California, and specifically in Santa Barbara County. So the assumption is at this point, if you do have COVID, it is likely the Delta variant.
Thank you, Matt.
Thank you for that. Okay, then the next one, whoever would like to answer, will booster shots be offered soon?
That might be a good Matt question. I mean, I can say that that's being looked at right now, and I think a little delay in deciding whether or not, I think we thought it was going to happen a little sooner, like the 20th of this month. but there's been a bit of a delay looking at the Moderna vaccine, I believe. But Matt's involved with that too. Currently, it's only available for immune compromised individuals. And then for the rest of us, it would be after 8 months after your last dose is what's being recommended. They're looking at Moderna particularly to look at the dose. So instead of like what they're doing currently with Pfizer, which is basically the same dose that you got the first time and the second time, and Moderna, they're looking at making that a little different. And I think a supply thing is an issue too, when it's available.
Great. Couple more questions. The next one was, if my child has some symptoms of COVID, how do I know when to take them to the hospital versus just to a doctor versus just to keep them at home?
Well, the recommendation is any of the symptoms, like I mentioned, even a runny nose, when you think it is, that you think it's just a cold, but you want to keep them home and contact your medical provider. And they'll determine whether or not they want to do a COVID test or, do a rapid test. Or looks like Theo is one of the nurses that's working with this Safe Schools Forum. He raised his hand, so he might have another answer.
I just wanted to add that the time to go to hospital is with emergency symptoms of COVID-19. So if there's any struggling to breathe, shortness of breath, they're really lethargic in little children, things like that is what would prompt going to emergency based on symptoms.
Thank you. Okay, and I believe you had addressed this in the presentation, but do schools have COVID tests available for students?
Some do and some don't. So there's a little delay on some of the schools getting on board. Matt raised his hand, so, but yes, some do and some don't. So it's, there's a national shortage of the antigen test or the rapid test right now that California schools are using. So the state public health department is trying to onboard schools to be doing this testing, but there's a supply issue and then just a delay. And Matt will say more about that.
Yes, so the state has made a couple testing programs available to schools to assist with student and staff testing. There have been a few delays and some supply issues with the antigen testing programs specifically. So it's really dependent on the school and the school district, what program they have enrolled with the school and what they're offering for testing at this time.
Great, thank you. Okay, then the next one is public health able to help medical providers with testing as there is an influx of kids needing appointments?
That's probably a Matt question, if he's available. Right now, public health also has a shortage of supply. And, one of the things I have reached out to a lot of the medical providers, and I was told that, some of them were using the test where you had to put the, it's called nasal pharyngeal, when you needed to put the swab way back up into your nose, and that had to be done by a medical provider. And so it was really disrupting their flow in their offices. So once it was determined that they could just use a swab in the front part of the nose and that other people could be trained to do that in their offices, it kind of freed people up to do that. But there is a supply issue there too. Matt probably wants to say something about that.
Yeah, there's less of a supply issue with medical-based testing and resources for that. There are resources available through the state. If any providers need assistance with obtaining resources, they can go to our public health department website, and there is a link for a resource request form.
Great, thank you. Okay, just a couple more. And I think this was touched on near the end as well. Do parents need a doctor's note to get an exemption for their student to not need to wear a mask at school?
Yes, and it has to be a licensed healthcare provider, physician, nurse. Yeah.
The next one is, how many symptoms does a child need to be sent home from school?
1 was the quick answer. Yeah.
Okay.
Yeah, because schools are being very diligent in trying to separate symptomatic children from the population. So, yeah, and it's been tough too, because I've had a lot of phone calls from parents that it's just a cold. And why is my child being sent home? So I think everybody's just trying to be overly cautious, doing their due diligence to try to protect all students. So they are excluding students with 1 symptom. A runny nose will send a child home.
Great. Okay, and then I believe this is the last question, at least that I saw. Parent said this information is very useful and valuable. How does public health inform parents of all this information, aside from this tonight?
Well, I think like this tonight, and also I believe before school started, there were some parent meetings that schools held and had public health representatives. You know, any school can do what you guys did, reach out to public health and ask for a presenter. And I think
we
go
also
ahead.
have many of these resources are on our website. Specifically, we have a website site just with school information. And many of these documents, a lot of the infographics that Georgine shared are available on that website.
And SBCEO, the County Education Office's website, has a lot of parent information on there too that can be shared. You can put both of those. You can send them out however you want, the links.
Megan, there's one more
Yeah.
question. Do you see that?
Yes, I just got it. When will they start having the COVID test at elementary schools?
Is that related to when Santa Barbara Unified is going to be doing testing? They're starting next week. Some of the elementary schools have been doing testing, but mostly just testing children that are symptomatic with the rapid tests, and some that have been close contacts. So they're doing, and Santa Maria Bonita has been doing it. All of the schools, not all of the schools, but some of the larger schools have been doing their own testing. And I'm not sure, you'd have to ask your school, I think, too. Yeah, go ahead, Matt.
It's really a school or district dependent process, what they will be implementing as far as testing and when they will be able to implement it.
Great. That was all the questions that I saw. So I think that was the end of the questions.
Great.
I believe Gina put in the chat link. Gina, do you want to explain that link for a minute?
Actually, I'm gonna unmute Kirsten and she can explain the link. Okay.
Thank
Kirsten,
you. Can you hear me?
yes.
So the link that she sent out, that's the SBCO website, has all of the resources that the presenter mentioned on our website related to COVID-19. So it's kind of a clearinghouse page of lots of different resources.
Thank you
And
so much.
the one, yeah, Matt also put the link into the public health website for COVID information for parents and schools.
You know, and I just saw one more question come in. Is someone in charge of making sure information gets to parents' hands, Parent Square, email, handout, etc.?
That would probably be an LEA question. That is, like Matt had mentioned, it's, individual schools do it differently.
That would be a good question to save for our breakouts that we're about to go to.
I think
Yeah,
Matt,
I would ask those specifically in your breakout areas, what those districts process is for that. It is in some legislation that was passed earlier this year. The districts are required to make those notifications out to expose individuals in the school community.